Let's talk about Ren 15, Turtledove tail, source Yuan point. Ren 15 is located on the anterior midline, 1 sun, inferior to the sternocostal angle, or 7 sun, superior to the umbilicus. How to find Ren 15? The distance between the sternocostal angle and the center of the umbilicus is divided into 8 sun, which can vary considerably from the patient's fingered sun. Therefore, only proportional sun measurement should be applied here. A helpful device would be an elastic tape. From the sternocostal angle, measure 1 sun in an inferior direction and there locate Ren 15 on the anterior midline. It is often located directly below or, depending on individual anatomy, on the xiphoid process. Needling 0.5 to 1 sun obliquely in an inferior direction. The patient should be in an extended position. Caution should be observed because there is possible injury to organs with deep needling or oblique insertion in a superior direction, especially in patients with hypertrophied organs. Left, we have the liver. On the right, we have the heart. According to some classical texts, moxibustion is contraindicated. Actions, indications of Ren 15. Regulates the heart, calms the Shen, descends counterflow, lung and stomach qi, unbinds the chest, regulates the Luo-Connecting vessel of the Ren mind. Special features of Ren 15, Luo-Connecting point of the Ren mind. Important point for calming. Ren 15 is a very important and powerful point to calm the mind. According to chapter 1 of the spiritual axis, it is the source point of all the yin organs, which means that it affects the original qi or yuan qi of all yin organs. Ren 15 nourishes all yin organs and it calms the mind, particularly deficiency of yin in our blood. It is a very powerful calming action in severe anxiety, worry, emotional upsets, fears, or obsessions. Although its indications show that it can be used to open the mind's orifices in serious mental conditions. From a full condition, we use this point in mental emotional states occurring against the background of blood or yin deficiency. Ren 15 has an important influence on the chest. It opens the chest and promotes descending of qi. A useful aspect of this action is that Ren 15 promotes descending of both lung qi. So this is very good for cough, wheezing, breathlessness, and heart qi. Anxiety, sighing, feeling of oppression of the chest. The connecting channel of the directing vessel starts at Ren 15, which controls it. From this point, the connecting vessel branches out in numerous small branches, fanning out over the abdomen. When the connecting vessel is empty, there is itching of the abdomen. When it is in excess, there is pain of the abdomen. Ren 15 can be used for empty or full conditions of the connecting channel. Ren 15 is located at the tip of the xiphoid process, which is commonly known as dovetail in China, hence the name of the point. Calms the mind, it opens the mind's orifices, as in manic depression, palpitations, anxiety, and insomnia. Opens the chest and promotes the descending of qi, fullness and pain of the chest, wheezing, breathlessness, a feeling of oppression of the chest, sighing, and cough. Ren 15 is the Luo-Connecting point of the conception vessel, from where the qi of this channel disperses and spreads down over the abdomen. The name of Ren 15, Turtledove tail, reflects the shape of the xiphoid process, likened to the tail of a dove, with the ribs forming the wings. In fact, historically, there has been some discussion as to whether Ren 1, rather than Ren 15, is the Luo-Connecting point of the conception vessel. The spiritual pivot refers to the Luo-Connecting point of the conception vessel as tail screen. an alternative name for Ren 15, and gives symptoms of excess, pain of the skin of the abdomen, and deficiency, itching of the skin of the abdomen. Later classics, including both the systematic classic of acupuncture and moxibustion and the great compendium of acupuncture and moxibustion, refer to the Luo-Connecting point of the conception vessel as flat screen, an alternative name for Ren 1, and ascribe the symptoms of excess and deficiency to that point. Ren 1, rather than Ren 15, as the Luo-Connecting point of the conception vessel, would reflect a neat symmetry with Du 1 as the Luo-Connecting point of the governing vessel. Like Ren 13, the frontal point of the heart, Ren 15 has a powerful action on calming the spirit in cases of phlegm obscuring the heart, epilepsy, mania disorder, mad singing and walking, and aversion to the sound of people talking, as well as regulating stagnation of qi and blood in the heart region, giving rise to oppression and pain. Also, like Ren 13, Ren 15 is able to regulate and descend lung qi in cases of wheezing, cough, dyspnea. In the spiritual pivot, Ren 15 is listed as the Yuan point of the cow. This term, the same cow as in bladder 43, refers to the area below the heart, whilst Wang refers to the area above the diaphragm. It is said that when a disease enters the cow Wang, it is difficult to cure. Master Zhuo Chu's tradition of the spring and autumn annals, one of the earliest textual references to acupuncture, describes how, when the Prince of Jin was gravely ill, he sent for the famous doctor Yi Huan. After examining the patient, Dr. Huan declared that the disease had settled in the Kawang region between the heart and the diaphragm, and hence it cannot be purged. It cannot be reached by needling. Herbs will not penetrate it. There is nothing to be done. Despite the statement by the spiritual pivot, which implies that the cow originates at Ren 15, this point is not normally understood to treat deep and chronic deficiency diseases, the only relevant indications being diminished qi and excessive sexual activity leading to exhaustion in youths.